Malaria is an acute febrile illness caused by Plasmodium parasites, which are spread to people through the bites of infected female Anopheles mosquitoes. According to the latest World Malaria Report, there were 241 million cases of malaria in year 2020 compared to 227 million cases in 2019. This, perhaps among other factors, called for the need to curtail the spread of malaria in Adamawa State. Through Adamawa State Ministry of Health, saving 1 million lives for result in collaboration with Adamawa State Primary Healthcare Development Agency, supported by World Health Organization (WHO). It is pertinent at this point of the season to adopt strategic approach by engaging media professionals, traditional and religious leaders for effective and efficient sensitization of communities in the state. Hence, the need to inform and orient stakeholders and key actors on the overview of seasonal malaria chemo prevention and methodology involved.
And these are some of the pictures we captured from the students when they were taking their medications. This is also some of the supervision that was carried out. We had to take pictures to show that people actually got to these locations. So thank you very much.
In addition, the seasonal malaria chemo prevention campaign was flagged off in the state for children from 3 to 59 months to be administered the drugs. Critical stakeholders gathered to witness the second round of seasonal malaria chemo prevention campaign implementation in the state. The executive chairman of Yola North, who was represented by his vice, appreciated the agency and development partners for their commitment towards supporting healthcare in Yola South and Adamawa State at large, promising to continue supporting healthcare activities in the area.
I tell you gospel truth. I did not buy even paracetamol for my last 2 children. So it means the medicine is working effectively. So I want to honestly appreciate WHO, UNICEF, SFH for your giant contribution to our people in this local government. Honestly, you have done us well.
The executive chairman, Adamawa State Primary Healthcare Development Agency, Dr. Suleiman Bashir Saidu, alongside the representative of the Adamawa State Commissioner of Health, Selin Lowry, described the collaborative effort by the ministry and other agencies on eradicating malaria as apt, going by the rising cases of malaria infection in Nigeria.
I'm so excited. It's one of my happiest moments. We made a call for the people of Adamawa State, mothers, parents, caregivers, to come out in their numbers to receive
distributing anti-malarials for 0 to 59 months. It's a very laudable program that has helped in reducing the incidence of malaria in our lives. So it's a commendable.
Development partners stressed the importance of complementing each other's effort to eradicate malaria, also assured their continued support to healthcare delivery in the state.
Our commitment is to show our appreciation of the effort that is being made by the state, by our development partners, and by the program in ensuring that our children do not die young. We know that SMC is having great effect. In our implementation, we have increased the number of states from 9 states to current 20 states. So that shows that the strategy is working. That shows that we are satisfied with it. And in the last meeting that we had with commissioners of states, where the strategy was implemented, we had a lot of good reports coming in there. So we are really happy.
Of course, as mentioned, SMC is a highly impactful intervention and highly acceptable by the communities. And based on the anecdotal reports and testimonials we have received from health facilities across the state, is that of the fact that the malaria burden has significantly reduced among the under 5s. As a matter of fact, you hear health facility workers saying they are no longer seeing children under 5 patronizing the facility, especially during the month of implementation.
Representative from the Seasonal Malaria Chemo Prevention Campaign revealed that it was a strategic move, making Adamawa as one of the benefiting states for the campaign in order to make a concerted effort in curtailing the menace of malaria in the country.
The SMC for the whole country, and we are fortunate to be supported by WHO, and also our major stakeholders were all they have already put their hands together to ensure that the success of the campaign. So the implementation of SMC in Adamawa State has really reduced a lot of malaria burden in the state.
The that we use, the team is before is 3, but now it's 6. Based on the 6, we arrange the first, because we have 17 settlements in the Boko ward. We separate the teams according to settlement, and we plan it well so that they will follow. Each and every child will receive the drugs.
In view of the significance of the exercise to the community, the district head of Yola South, Sarikin Chikasorong Adamawa, Alhaji Ahmad Muhammad Mustafa, assured the support of the traditional and religious institutions towards ensuring the success of the campaign across the rural communities.
Alluran da ake bayar waɗannan daga haihuwa har zuwa shekara 5, in yaro ya yi scaling wannan shi kenan ya wuce komai, amma kamin yaro ya yi wannan shekarun nan wallahi shine damuwa. Malaria ko mun sani, in malaria ko babban mutum ne in malaria ya kama shi sai a ce maye, an jefa shi da wani abu, don mutum zai fita hayar shi yana maganganu abun da ba za ka gane ba, iska ne a wajen shi, ba abun da ba a faɗa. Duk aikin malaria ne wannan, don yana taɓa kwakwalwar ɗan adam. Mutum yana maganganu sai a ce maye, a kawo boka ko wani abu a ce a bashi magani, ba shi ba ne. Shi ne aka ce in abu ya dame ka ko ɗanka ka je asibiti, kamin a gane me yake damun yaron nan a yi test, a nan za a gane ga abun da yake damun yaro. Domin wallahi in mun tuna akwai waɗanda suke da kuɗi amma Allah bai ba su haihuwa ba.
No doubt, the significance of strong malaria surveillance systems and prevention cannot be overemphasized, as it helps countries design effective health intervention and evaluate the impact of their malaria control programs.